Lebanon is currently facing its worst financial crisis in recent times. The World Bank characterizes this financial crisis as the third most severe financial crisis globally in recent times. So, along with the COVID-19 pandemic, Lebanese cancer patients are currently facing a war on two fronts. So we decided to do this multicentric cross-sectional study in order to analyze the challenges and perspective of this particularly vulnerable population. So we prepared a questionnaire in order to assess socio-demographic data, challenges faced during the pandemic, perspectives concerning cancer and COVID-19. We also prepared a scale, which we validated in order to assess knowledge level regarding COVID-19 in this population. Patients were interviewed in chemotherapy units from 4 different private and public hospitals in Lebanon during December 2020 and March till June 2021. In total, we interviewed 272 cancer patients. We asked them the questions from the different parts of our questionnaire. And then we correlated the socio-demographic data with the challenges with the location, if it's a private or public hospital. We conducted a multivariable analysis in order to try and find predictors of increased or decreased knowledge regarding COVID-19. And we also assessed perspectives of cancer patients regarding their cancer and COVID. A striking finding was that concerning the salary of cancer patients, it changed negatively in 45.6%. It did not change in only 7.7%. And 46.7% of participants did not work. A staggering 0% of participants reported an increase in their salary during the timeline of our study. Some challenges, such as transportation problems, faced by 39%, inability to reach the physician by phone, faced by 16.9%, deferral of chemotherapy dates, faced by 31.6%, and difficulty finding chemotherapy medications, faced by 49.6% of participants. All these challenges were more likely to be reported by patients receiving chemotherapy in public compared to private hospitals. Other challenges we reported include not being able to find non-cancer related medications, such as hypertension drugs, anti-inflammatory drugs, antibiotics, diabetes drugs. This challenge was faced by 71.3% of participants in this study. So if it's cancer you have with other comorbidities, it is very hard to treat other comorbidities along with your cancer during this time in Lebanon. The challenge of not being able to find non-cancer related medication was increased when comparing December 2020 with March till June 2021 with a p-value of less than 0.02. The perspective and challenges of our patients must be taken into consideration in order to deliver better care to these patients during these unprecedented times. So I believe the results of our study must be taken into consideration when dealing with our patients.